And we are live.
Good. Well, good morning. This is Senator Dave Weeks from Rutland County. It's January 19th, roughly a little after 9 o'clock. We're continuing our conversation with the RAND Corporation in regards to the early care and education financing study. And I believe the intent is kind of a round robin on questions from the committee. But what I'd like to do is just see if any of the representatives from RAND have any residual comments from yesterday or any insights they'd like to share before we kick off our round of questions.
This is Christos from RAND. I don't think we have any particular comments, just really appreciate all the good, insightful questions and anything that we can help, clarify. We're more than happy to.
Okay, so how about if you agree, Senator Hardy, if you'd like to kick it off?
Oh.
We'll swing around the table, kind of do this, if folks have questions, kind of limit it to one question at a time.
Sure.
And then we'll make a circle until everybody's got their questions answered.
I unfortunately started a new notebook this morning. I left my old one that had my list of questions. So it was the last page in the notebook. It's so satisfying when that happens. But so I think you answered most of my questions, but there was one question I had that was sort of holdover, and now I'm trying to remember it, that you were gonna get more information for us.
I forgot who I was looking at the phase-in of the gaps.
Yeah,
Or...
exactly. I think it was especially because I'm concerned about the cliff, and if we are changing, the 350%, the 3.5% of poverty cliff, and if we phase in a new subsidies for families. How did you guys imagine that?
Let me maybe, if this isn't what you're looking for, just let me know. But
Okay.
Maybe this is. So this is on the
Even the report or
52
the
of the report. Yeah, table 4.3. And so just to remind you, this is a subsidy schedule 2. So what this does is it caps the contributions of family up to 3.5 times poverty at 10%, and then it resumes the schedule but provides subsidies up to 5 times the poverty level. So the total annual gap would be $258 million if you 100% phase that in. And to kind of illustrate one approach, again, you can phase it in any way you'd like, but what we did is just say, let's say you want to take on 25% of that gap a year, right? So 25% is 65 million. So in the first year, you would take on $65 million. The next year, you take another 65 for $129 million. That's half the gap. So over 4 years, you're kind of phasing this in. For each of these 6 options, what we said was, what types of taxes would allow you to cover those funds cumulatively throughout the 4 years? And so this first column looks at the payroll tax. So a payroll tax of 0.29% would cover that first 25. That payroll tax would be a total of 0.57% the next year to cover 50%, and then that increases until you get to the final 1.14 number for the full gap.
Okay.
And so the same thing happens to the sales tax, the limited service tax, the extended service tax. So if you read down the column, that's how those taxes as a single source would be used to cover the full gap. And then options 5 and 6 show what the bundle progression would look like.
Okay. I think I'm more thinking about it on the subsidy side than the revenue side.
Yeah.
Because this is the phase-in of the revenue.
Yes.
So your base assumption, I don't remember, option 2 was to keep the upper limit at 350% of poverty.
It was
for
up to
subsidy.
500.
Oh, you did model it out to
Yeah,
500.
every single one is modeled out to 500.
But the sort of low end cost is the 350%.
That's
yes. Right. Okay. So if we were to stay with 350 or move up along, and we are contemplating right now how high or if to raise above 350.
So this chart, or maybe this chart will help you. It's 3.4 on page 37. And so what this does, it says, as you move up the poverty level of the salary, the income,
Yep.
how much more cost would you incur and how much would that gap grow under each of the scenarios. So probably the last 5 rows where it says gap in schedules. So for example, if you were to just number 2, status quo. So this is the, right, if you were to just fund up to 1.5 times poverty, but fully, that would give you, these are in thousands of dollars. So that'll give you a $6.2 million gap. If you were to then go up to 2.5 times poverty, that gap would grow to 106 million, 106.9 million, 3.5, so on and so forth, until you get up to the full 5 times poverty, which is at 258 number.
Okay. And do all of your models assume that the no cost just goes up to 1.5%?
Yeah, so the very base one is 1.5, right? And that assumes that anybody below 1.5 does not contribute anything.
Okay. And sorry, can I ask a related question? I
Sure.
keep going, okay.
Yeah.
I'm trying to understand the phase-in.
Yeah.
So, do you, oh, sorry, I lost my train of thought. Sorry.
We can
Come back to me, because I totally lost my train of thought when I asked if I could ask another question. Morning, Madam Chair. I left you an orange.
Oh, bless your heart.
The center lines, what we've done is we kicked off, we're kind of doing a round robin of questions.
Perfect.
And we started with 7 to 8. And we'll just go around the table and address questions from the study. Yeah.
Keep going.
Senator Williams.
Um,
Oh, I wrote later. I have none right now.
Well, I don't know if we ever had that middle class question answered, which would be fabulous, just to put all of this in like a context for me. And then my other piece after that, which is super high level, but you did talk some yesterday about so we're generally looking at this right now as this very large expenditure. You did touch upon yesterday how this is really an investment and ultimately it will pay dividends. So I was wondering if we could talk a little bit more about that, just to sort of offset this narrative of the fact that this is just ginormous, expenditure right now, and that ultimately it will, it's going to pay us back.
Yeah, which one would you like to start with
Let's
first?
start with middle class.
Okay. So I'll start off, and I know Lynn has done also some research last night to try to answer it. So there is no quote unquote definition of the middle class, right? A lot of people are trying to figure out what that means, how that's evolved, right? So we tried to get some numbers with the help of JFL, which we appreciate, to put some context in. It's.
Want to hand this out? Mr. Chair. So
Terrific.
this is only Joyce put together. There's no bell curve.
Yeah.
What Joyce did, she threw together an FPL thing, and then the bottom, it's just listed a bunch of other benchmarks. So you have the Vermont livable wage, the state average annual wage, the Vermont median household average age, or average income, Vermont average household income, and then another chart, U.S. households with children under 18, middle third. So it's just a range. So I'll let you pass that out.
Okay, great. Thank you.
But that was the best that we could think of on the fly. That
Did you work with Joyce on this
Joyce
one?
created that.
Joyce created this. This is great.
She couldn't be here. Oh, she's in Zoom. Oh, she's here.
Yeah, the
Zoomed in.
bell curve was a red herring.
She zoomed in.
Oh, there's an extra copy?
You have one.
You have one? Okay.
Okay.
Yeah, great, thanks.
I'll take it.
So I think, so the top,
No one needs it.
the top row shows the poverty guidelines for 1.5 to, or 150 to 500% at the poverty level. So you can use that to kind of benchmark the different schedules that we created. And then the bottom gives you some kind of statistics on what the income looks like in Vermont. So the minimum wage is about $26,000. The livable wage that was calculated by the B&B report was about $32,000. The average wage is $59,000. The median wage is $67,000. And if if anybody wants me to explain the difference between average and median, I'm happy to. And then the average household, the average income rather is about $90,000. So if you look at the 500% salary schedule, that would be above the average household income of almost double the median income. And so in depending on how you want to kind of define the middle class, the upper end of the salary schedule would perhaps cover a lot of families that you would consider middle class.
The upper end of this.
Of the 500%. Yeah, and Lynn, did you wanna add something?
Yeah, just a couple other points. One is that whether you define middle class as a relative concept, which is where you are in the income distribution relative to other families or households, or an absolute concept such as your income would be, up to $100,000 or $125,000. Typically what you see is that roughly about 20% of households are considered in that upper class. So the middle class and those who would be below the middle class are the 80% of the population below that upper 20%. And sometimes even the concept of the middle class is those between 20% and 80% of the distribution. So you're getting 60% of households, 20% would be considered low income, the top 20% high income. And so that roughly corresponds to when we're using 5 times poverty, especially when you look at where children are, young children are in their families and the income distribution for those families. As we noted early on, using that 5 times poverty threshold captures about 80% of children that are preschool age. And so, you could view that as roughly excluding children in the top 20% of families based on their income, and you would be covering everybody else. If you just go up to 3.5 times poverty, that's capturing children, 60% of children starting at the bottom of the distribution and moving upwards.
Thank you. Thanks. I really appreciate you taking the time to do that. I know what is middle class. We could probably have a whole 3-hour discussion on that. Is it even just like a state of mind? But we do throw it around as a metric, so it does seem like it's nice to have some kind of definitions. Appreciate that.
Yeah. Can I ask a question related to your topic and related to this chart, which this is helpful? Vermont livable wage seems a little counterintuitive. We're talking about expanding beyond, expanding into populations which are, 3 times poverty level, et cetera. What does livable wage really mean then? It's, this is a new concept to me. I mean, I've heard the term, but what's livable, what's not? Why?
Joyce, do you want to take that or you want me to take that? It's our favorite question.
Well, I think it's relevant because we're trying to understand how much is enough, and we're also, constituents are looking at a very big price tag and trying to understand why, how much is enough.
It's the right question. I'll let Joyce take
It's a
it.
great question.
Yes, thank you very much. So the Joint Fiscal
For
Office.
the record,
Oh, sorry, for the record,
Thanks,
Joyce
thank you.
Manchester, I'm out of practice. Yes, so let's see. The Joint Fiscal Office is required to issue a basic needs report every 2 years that includes how much it would cost for various family household configurations to live in Vermont. The problem is that it's very difficult to get the measures that we want that would accurately reflect the needs of families or households at different income levels. So the living wage is defined in the law to be what it would cost for a single person who shares housing with another adult to pay for half of the household expenses for a year. Okay, so that is defined in law, and we do our very best to come up with a figure that reflects that expense level. It does include taxes, it includes some savings, it includes all the normal household expenses you would think of. But we do that update every 2 years. We struggle with how to measure transportation costs. We look at rural versus urban households. There are differences there. Families with children, of course, have to pay for childcare, and so we struggle for how to reflect that cost. So it is a measure. We do our best. It is not a perfect measure.
Okay, thank you.
That help? That's
It
good.
does help.
Yeah, thank you.
Can I follow up on that? But this,
Sure, go ahead.
this 31,000 that's on this is just a single person, right? Or
Yes, a single person sharing housing with another adult.
with no children?
No children.
So if the two people together would they'd each have this livable wage in order to make ends meet.
Right.
Okay.
And the last column, which I didn't mention that Joyce put together, was US households with children under 18. So if you look at the middle third of households in that, they make, the bottom of that is 60,000, the upper end is under 30,000. And for reference, like the Vermont households are about slightly below it, the national average. So it roughly corresponds.
And this really does help to put into context what we're talking about in terms of poverty level. You know, we talk about 3.5 or 1.5. Go ahead.
The livable wage is sharing a dwelling with one adult, no kids, who is also making this wage, correct?
Yes.
So it's a combined income of 62.
Yes, Joyce is also shaking her head, so I'm sure.
Thank you. Thank you for the clarification. And then I could maybe circle back to my second question about that.
Oh, yes, remind me, sorry, your second
It
question.
was the investment piece.
Oh, yes.
Thank you.
Yeah, so the way I kind of look at it, and then Lynn, I think, Lynn, did you have your hand up about something else, or did you want to take this one?
Maybe before you go on, I did want to just comment on the livable wage. So early on in our project, we did look up, because Joyce, I believe the report that you all do does look at other configurations. So what that livable wage would look like with 2 parents and 2 children, 2 parents, 1 child, 1 parent, 2 children, and so on. So those estimates are available. I think the other, in my mind, another important thing about the concept of the livable wage, which is various groups calculate this, not just what JFO does. But what it's also trying to capture is the notion of what income it would take to be self-sufficient. So this is the amount of income a family would require in order to be able to afford the cost of healthcare, to afford the cost of childcare, to pay for housing without subsidies. So the notion is that with this level of income, a family would be able to cover those expenses without reliance on public subsidies, whether that be cash transfers, SNAP benefits, and same thing with childcare subsidies. So conceptually, it's trying to capture that, which is often why it's a big number for many people when they see it, because many families with income below these levels are drawing on or benefiting from various kinds of government transfers, and that also includes the earned income tax credit. So these are levels that would mean you're not drawing on any of those public benefits, but otherwise have sufficient income, cash income, to cover all of the basic expenses a family, with one of these configurations would need.
Okay.
Thanks, Lynn. So to get to your other question, the way I kind of look at it is those short-term benefits, some of which we captured in the report, and then those longer-term benefits that are outside of that 5-year time horizon that we didn't capture in the report because it wasn't within the scope. And so some of the short-term benefits would be some people entering into the labor market, which would grow the Vermont economy between $59 to $218 million per year in additional gross state product, depending on how far up the subsidy schedules and different assumptions. And then local and state tax revenue would increase because you're paying you're paying childcare workers more, and then more people would enter the workforce. So those revenues would increase between 1.5 or 18 million, again, depending on the situation. And then, you're talking about some more of the intangibles that we hear about: less stress, employers having a more stable workforce because they know that their childcare is taken care of. The longer term investment part is based on a deep bench of research that shows high quality early childhood education can reap benefits for the child and society as they go into the school age years and adulthood. And so some of the school age benefits might be something like less special education placement, which we talked about yesterday costs more, and so there could be some cost savings there. Longer term benefits have been shown as longer educational attainment, so people stay in school longer. That leads to better employment, higher wages, and so on and so forth. So in some ways, this could also be seen as an investment in the future of the labor market of Vermont. Of course, those take a while to realize, right? But some investments have to be done now so that you gain those later. And so those are the types of, when we say childhood, early childhood is an investment in society, those are the types of those benefits we're thinking of. Lynn, did you want to add?
It seems like the long-term.
I think that's great.
It seems like the long-term benefits are hard to quantify too at this point. No.
The long-term benefits are hard to quantify, and it's always, it's based on what happened in the past. But I mean, these kind of thoughts are based on actual things that have happened, and economists try to talk about what would be the lifetime earnings that would increase as a result to people who work longer, get more out of school, and all that stuff. So it's a bit hard to quantify, but they are also real.
They're real. Yeah. Okay. Great. Thank you.
Are there other questions outstanding?
Unless.
Go ahead. No, I'm holding off. I'm good. But I get there.
So for the sake of constituents and for my own education, the concept of high quality early childcare versus the training certifications necessary for those that are engaged in, again, contact. Okay, so yesterday we were talking about the recommendation was lead teacher with a bachelor's, assistant teachers with associates. And I had to try to frame the question about associates versus certifications. And I'm wondering, so the question that's come back to me already from my county is how much is enough in education? And because they're leery of overregulation. And I just like, if you would take a moment to explain, why RAND has pegged quality early child health care with those bachelor's and associate's degrees, and in reflection too. And I think you have like two groups of care providers, one being the larger and the other being the small FCC something.
Yeah, family childcare hubs.
Right, and if you could kind of differentiate between the two on necessity for those qualifications.
Yeah, absolutely.
And again, I'll start in the
I mean, before you start, I just want to say that this was a question that was asked yesterday during the Appropriations Finance Committee meeting. So it's a good question, and I think Lynn and you both gave us good information. So.
And Lynn, you can jump in after I started off. So when we talk about quality early childhood education, and when we talk about the credentials, first of all, it's some of these credentials are already required, right? So Head Start requires these credentials. A lot of public pre-K programs throughout the United States and different states are requiring these credentials. So this is kind of a trend that's happening across the country. And for certain programs like Head Start that Vermonters already participate in, it's already a requirement. But the idea behind that sort of requirement is that quality early childhood education means, it's an education, right? And so you are trying to develop the whole child academically, socio-emotionally, in a host of different ways. And we have learned a lot over the past 10 to 20 years about exactly how a child's mind develops from 0 to 5. And it's a lot more than we thought. It's a lot more critical than we thought. And so there's a lot of science that goes into how do you structure the interactions, how you structure the education in order to make those the most fruitful and advances the child most. And so when we talk about getting these sorts of the degrees, the idea is that you teach them, to teach the providers those sorts of skills so that they can impart them to the child. And that then defines high quality, and then that then is theorized to reap those benefits that we just talked about. We, in the report, we purposely do not make a distinction between family child care homes and centers because it's a family's choice as to what type of environment they want their son to get their kid to, but you still want that same quality, you still want that same inputs that requires that same skill set of providers, regardless of the types of settings that the families choose to send their child.
So just to be clear, there is no qualification distinction between the two types of facilities, two groups of facilities. It's
That's right. Well, in our report, we assume the same.
Okay.
Yeah. Yeah. And Lynn, did you want to add something to that?
Just a couple of other points. I think, again, we emphasized yesterday that this is building from research, evidence-based research on what supports children's learning. Some of the strongest evidence of the benefits and the effects on school readiness and school performance comes from programs where the lead teachers, for example, have a bachelor's degree. And I do want to emphasize that it's not just a degree or credentialing issue. We've learned from the research that it's training specifically in early childhood development, and whether or not that's the name of your degree or you do additional hours of training specializing in that area, that's what's critical, because it's the knowledge. It's not just that you could do the work to earn a bachelor's degree, it's the knowledge about child development that comes from that coursework, from the practicum that goes along with it. And so one of the things the field has also been working on is raising the quality of those degree programs so that they contain the content that we know matters for supporting teachers to be effective in their work with young children. So it's important not to view it just as credentialing. It's around the knowledge and skills and capacity that those individuals then have to work with young children. It's also why we tie it to things like an evidence-based curriculum. So again, if you just put a well-qualified teacher in a center where they're not able to use a curriculum that we know is going to be effective, then again, they're not going to be as effective in supporting those children in their development. So it's a linkage between the human capital, the individuals in these settings that are supporting young children, as well as the other resources they have access to. And we go into more detail in that in the report, for example, ensuring that teachers have planning time so that all of their hours, whether they're in family childcare or in a home setting, if all their hours are spent with children, directly with children, providing supports, caring for them, then they don't have that opportunity to sit back and reflect or plan how they're going to promote children's learning through time, how they're going to even individualize instruction for specific children. So it's this combination of the knowledge and credentials with a supportive environment for the staff, as well as the resources that they have in the classroom, class materials, curriculum, and so on. And we build all of that into those estimates of the cost. And as Chris says, there are some differences in family childcare homes in terms of the differences around some of the resources that they use beyond the staff that has somewhat lower costs for them on a per child hour basis. But we are otherwise assuming that it's similarly qualified individuals and with similar access to resources like curriculum. So I'll stop there, but I think this is a really important point. Now, it's also important to recognize that the workforce may not be there today to meet those qualifications. So that would be a process through time supporting the workforce to gain those additional degrees and educational experiences and the ongoing professional development that would support them as well.
So, thank you for that. I mean, that's important. There are important linkages in what you've talked about, probably linking it further into the STARS program that we have, so that the more teacher development available, then perhaps improvement for the center as a whole. So as we learn more about the STARS program, that may, link in. Nolan, you wanted to make a comment?
Yeah, just for the record, well, I just blocked this. I also want to point out that the term high quality wasn't a term chosen by RAND. It was a term in the legislation where we required them to use a high quality system. So I think it goes to the legislative intent, which I think Senator Lyons can speak more to.
Yeah,
Just
high
something
quality.
like that.
Yeah, thank you for that reminder. Legislative intent is really important, having just come from LCAR. Okay. Okay, was there another question before I ask a question? Okay, well, have you gone through the 4-year phase-in discussion as yet?
We did,
Okay.
if you weren't here, we could do that.
Yeah,
again.
and I remembered my question. I wrote
Oh,
it.
good, well,
Oh, okay.
you asked your question. We can go back to it again. I mean, I've
Yeah,
been getting it
yeah,
from a few different places, so this is good.
So Chris did go through the phase-in for the revenue tax side, but I was more interested in the phase-in from the subsidy side.
Thank you, that's what I was
And
interested in.
that was,
Oh, you
that's
wanted to do
Yeah,
the
where,
subsidy
that as well. but-
yeah, and so we were on page 37 of the report that has the
Okay,
table
good.
of the phase-in. And so I have a few questions that I wrote down that's related to this. First of all, how did you calculate the 10%? I know how you calculated it on the gross level, where you added up all of the, revenue sources statewide that go into early childhood education and care. But on an individual family basis, how did you calculate? Is it just based on the level of subsidy they get from CCFAP, or did you also include things like the tax credits they may be getting and things like that?
Do you mean the 10% cap?
The 10% cap of what they should pay. And I think you modeled it actually from lower than 7% up to 13%.
So depending on the schedule, yeah,
Yeah.
exactly, yeah. To give you some sources. Lynn, do you want to take that question?
Sure, I'd be happy to. So the way we looked at it was step aside from where the subsidies come from, that the expectation is that families would be making a contribution and it would be tied to their income and it would have this threshold. So looking at where families are in their income level, we assume that, in this income range, this would be the maximum contribution, which would be, either based upon these schedules or the schedule plus a threshold or a cap. So then the issue is, how do you operationalize that? And so that's really a matter of implementation. So for example, if a family is receiving subsidies through CCFAP, you could determine based upon their expected income or known current income, what their contribution would be. So no higher than the 10%. Then the question is, well, do they also qualify for an additional subsidy on their tax return? Because based upon their spending, their income, and the schedule under the child care tax credit, both federal and state, if they apply for and get additional subsidy through the tax credit, then in effect, their contribution has gone below that threshold. So one consideration might be, do we need to somehow now integrate, if you still have the tax credits, that with the subsidy system, so that you really are holding families to, a given contribution level, and some families might not get as much subsidy as they're really eligible for. Some might get more subsidy depending upon where in the system the subsidies are coming from. So that's something that really comes to implementation. We mentioned the possibility, for example, that you could use the tax code on an annual basis to reconcile how much did families contribute toward the cost of care less any subsidies, and what percentage of their income was that in actuality, and then would they be due some additional refund, or might they owe a little bit more because they got more subsidy than they would be qualified to receive. So that's one way to try to reconcile it. You can try to do it as you go along through time as well. But that's partly a function of the complexity we have in the system now, where there's not just one funding stream that's supporting these kinds of subsidies, right? We pool all that together, but the reality is that there are these different mechanisms that provide subsidies to families, and usually the mechanisms don't talk to each other. So
Right.
CCFAP doesn't know what people are getting through the tax code, right? The tax code
Exactly.
doesn't require that you report CCFAP. So
Yeah, and I appreciate you saying that the possibility of reconciling it through the tax code, because I was thinking, do we reconcile it just through the CCFAP subsidies and just actually get rid of the state tax credits so that it is just in one place, or as much as possible in one place? But reconciling it through the tax code is an option I hadn't thought of, and it is certainly a possibility. It does complicate people's tax returns, but
Commissioner Bolio would love it.
oh yeah, I can just hear him now. Okay, that's really helpful. Thank you. And I guess also, if I may, Madam Chair,
Go ahead.
the 10% amount, I know that, for example, the sort of classic 30, you shouldn't spend more than 30% on housing. And I've seen the sort of research behind that, and that seems to be well documented or whatever. At least everybody believes it now, or not everybody, but it's mentioned a lot. What about the 10%? Is there, where, did you guys do research about if that is the right amount, or was that just because we mentioned it in the legislation?
Yeah, we mentioned it in the legislation. I mean, you mentioned it in the legislation,
Yeah.
so that's the charge that we took on. So we didn't kind of really talk about why that may or may not be the right number. The 7% though that we modeled came from the Build Back Better plan, which, you know, over time has become less perhaps of an option that's going to happen. But since that was part of the policy conversation as well, we threw in the 7%.
And is there something behind the 7%, or was that also just something that legislators at the federal level came up with?
That's something that the legislators at the federal level.
Okay, so do you know of, as actual economists who do this research, do you know that if there is a percentage that has data behind it?
Yeah, that's a great question. Lindsay, I don't know if that research is for you.
I have an answer.
Okay.
So I think it came up yesterday, the National Academy study that looked at transforming the financing for early care and education with a well-qualified workforce. I think that was the name of the study. There's an entire appendix in that document that those of us on that committee developed because of this question. What can families afford to pay as a percentage of their income, or, you know, an absolute amount, whatever way you might think about it. And there is a body of research that, you know, looks at this question. Much of it sort of consistent with the way when the poverty line was originally developed, and Molly Yarshansky determined that over 1/3 of household expenditures went to housing, and then she used that as a multiple to develop a threshold. So we look at consumer data, consumption data. We look at household decision making, and you know, where incomes are that families are not necessarily having to trade off childcare with other essentials. The bottom line is that research is not definitive about what the right threshold is. The 10% threshold is one that the federal government had used for a number of years. Recently, they've switched to using 7%. And again, some of this comes from observation of what families actually spend, and where they, you know, may be constrained in choosing childcare over other decisions about, you know, whether it's housing or food or healthcare. The way I tend to think about it is what percentage of income can families afford where they're making choices about childcare use that's independent of cost, so that they, if they're contributing 3% of their income, then that's not something where because they're spending that 3%, they have to spend less on housing or healthcare or food. And as you go up the income ladder, 10% is probably too low. Families may choose, as their incomes get higher, they want to spend 20% of their income because they want, the Cadillac version of childcare. And that's choices that they're making, but they're doing that in a way that doesn't constrain them from then, they may be trading off against an expensive vacation, not how much housing or food or healthcare that they can afford. So that's where this gets, tricky, trying to figure out what that right threshold is. But certainly the 10% and the 7% in the policy discussions is a range. And it's what the National Academy's study also used in their work.
So is it, sorry.
I was just gonna, before you ask that next question, I was gonna ask, could we get a link to the National Academy study?
Yeah, it's in the report. And this discussion, I think, might be in a footnote. Let's see if I can find it.
I forgot, it's we can link into it. I've got this written report, so I can't put my finger on it and have it pop up, but, so that's good, that's helpful, thank you.
So is it, sorry.
If I could just back to the same question.
Yeah.
Where in the reference, which reference?
Lynn's looking it up now.
Yeah, the National Academies of Sciences, Engineering, and Medicine 2018. It's in our reference list under that citation.
It's a long document.
Alex is getting it. We're golden. We're golden.
So is it fair to say then, based, thank you, I appreciate that. Sorry, people all moved down the screen. Your explanation of the percentage, and is it with that last piece you said is a really, really good point. So is it fair to say that potentially a sliding scale of percentages where we start lower, maybe 3 to 4% and go up to 15% or something like that? And
that's exactly Schedule 2 essentially does that, although it caps it in a range of 10% up to 3.5 times poverty. Just because the schedule now happens to have, for families of size 3 and 4, you end up going above that 10% threshold as you get closer to 3.5 times poverty. You can see the difference between Schedule 1 and Schedule 2. That's the difference between having that threshold. It's a few $1 million. So it's just a small number of households.
Okay.
And Schedule 4 and 5 actually just limits by the actual percentage of the salary. So that's a fair way.
Okay. And then did you, in all of your schedules, use the 150% of poverty level as a no copay option? Did you ever model up doing a higher percentage, like 185, for example? Or 200 with no copay?
No, but the contributions are very small up to, again, I need the chart.
Yeah, I think up to 200. There's
around 2, 3, 4%. So, and that's again consistent with the current schedule. We sort of use that as a guide to start out very low. It's 0. And then it starts incrementing from there, again, depending upon family size, but around 2 to 4% as you move up to 3.5 times poverty. And then it goes up to, 5, 6, 7, 8, 9, 10, and again, a little bit above 10% for the families of size 3 and 4.
Okay, but the 150.
That's the current schedule. And under our schedules, we never went higher than the current schedule through that 3.5. So schedules 4 and 5 were even lower, up to 3.5 times poverty than the current schedule.
Yeah, so for example, at 200% of poverty, schedules 4 and 5 cap it at 3% of the income.
Okay, and do you?
So it's always sliding scale. It's sliding that percentage.
Oh, yeah, actually, sorry. This is from, this is from the actual slides that we sent out
Okay.
through yesterday. I'll
Yeah, I was gonna
share.
suggest that we go back, look at that.
It's,
They were-
yeah, it was 522.
Yeah.
Yeah, that one.
So, well, for example, schedules 4 and 5, which are these light dark blue lines over here. You can see that everybody up to, for all schedules up to 150% don't have any copay. 2% for 175%, 3% for 200%, and so on and so forth. And then the current subsidy schedule goes a little bit higher.
Okay.
So, but it all depends upon having some funds to insert and. fill the gap.
That's correct. So the schedules 4 and 5, which are more generous,
Yeah.
create those larger gap estimates that are in the report, because obviously if the families contribute less, the money has to come.
So could-
Yeah.
Can we do a slide that overlays the sort of income, the resources and the gap, filling the gap?
Do we have, well, we only model, in the slides, we only model table 2
Okay,
or schedule 2, so we don't have kind of
yeah.
that
The whole
overlay.
thing,
Yeah,
okay.
I mean, one way to think about it, this may be helpful for some, I don't know, is essentially as these schedules shift, the area under the curves is what families are contributing. So as you go from, say, the green curve that you're looking at now, that's the current schedule where we've extended it beyond 3.5 times poverty. So if you kind of kept the same pattern, then when you have that cap, it means the area between the green line and the red line, the black line in Schedule 2, that's now contributions that the families aren't making, what the public sector would pick up. And that's why schedules 4 and 5 are more generous, because now what the families are contributing, that area under their curves is smaller than the area under the Schedule 1 and Schedule 2.
And so you've monetized what's required in the little tables that you were just picking up.
Yep, and it's a direct trade-off. For every dollar that families aren't contributing, the public sector is picking up the rest. So, for example, as you go from Schedule 1, which is the current status quo schedule that allows some even below 3.5 times poverty to go to 10%, above 10% of their income. That's 263 million. But capping that 10%, since it's a relatively small fraction of families, it means 3 million less family contributions. So 3 million more in public sector contribution. As you go to that next Schedule 3, the only thing that's changed is above 3.5 times poverty, we add that 10% cap. So we extend the 10% cap. And that means that families are contributing about 14 million less, if I'm doing the math right, and that adds 14 million to the public sector contribution. So you can see as you reduce the family's contribution, then that's going to be a direct consequence for one, how much more the public sector would contribute.
Senator Wood.
Thank you. I have a question moving away from subsidy side and going back to the tax side. I was curious as to why hospitality always remained at 1%.
So what we tried, Erin can speak to this a little bit more, but what we tried to do is make sure that the hospitality, none of the taxes increased above what's typically seen in the United States. And the hospitality tax in Vermont is fairly high to begin with.
Gotcha.
But Erin, if you want to put more specifics on that.
No, that's right. That's spot on. What we were just trying to do with the bundles was, let's take a couple different fixed rates. So a fixed soda tax and a fixed increase in the meals and rooms tax, and then cover that gap in two different ways, once with a payroll and once with an increase in the sales tax. And what I'll say is, the only thing I'll say is, if you look at the baseline tables that's on slide, I think it was 31, those give you sort of rough order of magnitudes of incremental changes to the different taxes that we considered throughout the report.
Here, I'll share the screen for a second.
Yeah, that would be good.
It's on those handouts from yesterday as well, but
Here it is.
it's up there on the screen. So for example, that hospitality tax, increasing it by 1 percentage point will get about 14 million per year. And then the same thing, the increases that we have, those are the basic ones.
So the kind of the balance that we have to make is, can we achieve a high quality childcare system at the same time allowing for folks to live within their means and achieve the goals of either 7% or 10% or whatever it is of their salary, or 0 copays, depending on where they are here. And then not, and then how much money can we raise? What's the capacity that we have? And fortunately for us, that decision will be made down the hall, but it's a collaborative. We are going to be working very collaboratively with other committees on this, because any decision we make in here, of course, is going to affect the revenue side. So the expenditure that we're talking about making is an expenditure to improve quality of care for kids and ensure that that we can see an expansion of workforce and the economy. So there's going to be this little juggle and this little balance that we have. I know there are a lot of different opinions about how it should be approached and everything else, but this is the fun part. Okay.
If I could, in your table of prospective tentative revenue sources, there's no line item in there for corporate tax. So some of the benefit is seen by the corporate sector. Just curious.
So we did not model for corporate tax. It should be noted that the payroll tax not be paid by the employer or the employee or both. The corporate tax is a little bit tricky for a couple of reasons. Corporate profits are a bit volatile, right? Depending on the economic environment, the business cycle. So trying to model stable and sustainable tax sources off of that is a little bit tricky, considering you don't know what's going to happen in the future.
Is that more unstable than personal?
Yeah, I think so, yes. But Aaron, is there other reasons why we didn't?
No, the way that we were thinking about the sort of having companies pay for it was through that payroll tax, that it could be an employer paid payroll tax versus an employee paid. And that's, a decision that you all can make, not us.
It's also important to realize that, if employers pay more tax, then they might pass that down onto the employees in some way because their total burden is so much. So, everything's kind of linked into that like circular economy that we were talking about. So it's
Okay.
If I could, yesterday you offered a number of, I believe it was average cost of care, which is at 13,000 roughly. Is that a Vermont average?
Yes, that's Vermont.
So the question is, with high quality requirements, what is the estimated cost per child for the program that you outlined?
That's great. So embedded in other calculations are a per child per hour rate. Lynn, do you have that number in one of your spreadsheets, or you're muted, Lynn?
Table 3.3 in the report shows the estimated full-time full year cost, so 40 hours a week.
Well, hang on, can you just
Page
hold
36.
a second and we'll get the.
Yeah.
table.
I'll
Page
share
36.
Okay, if you share, that'd be awesome.
And I think one thing that's important to note here is that not all families have their infants in care. And when they do have their infants in care, not all are at full-time year-round care. So one of the things that's going on in our estimates of the total cost and our modeling is assumptions about the percentage of families that use care at different ages, the hours of care that they use, and the settings in which the caregiving takes place. So at the younger ages, there tends to be more use of smaller providers like family childcare homes, and a shift towards at least some time in center-based settings as children reach 1 or 2 years before kindergarten. So these are annualized costs, but not every household is assumed to have, so we're not assuming 100% of infants are receiving, full-time year-round care in our estimates.
The one thing I also noticed is that if you look at the price schedule currently, the prices are about, it goes a little bit, but the prices are about $13,000 to $14,000, no matter whether you're talking about a zero toddler or a preschooler. That's because what providers do is that it's more expensive to provide care for smaller children because you need, right? So they flatten that
I
out.
remember that whole conversation. I just wanted to zero in on anticipated cost per child. And this table 3.3 is the,
It's the per year per child cost in
I
different.
just want to be able to compare apples to apples.
Sure.
And it's in 2022 dollars.
It's $20.
Yeah, and one thing I would note is that this is largely because the model assumes that we would be paying childcare providers a larger wage that would be, not because of stricter regulations or anything like that. It's because we'd actually be paying people what they should be getting paid.
Okay, good question. Go to college for that. All right. Any other questions for folks?
So many questions. Can I have
Yes,
another?
What my question was, can the three of you sort of stick around for the entire session?
I'll clear my calendar. Was it 6 months, right?
Until May. What is it, May 10th? We keep hearing there's something happening.
That sounds good.
I'll extend my out of office message.
Exactly.
I think there's so much here that, now we're gonna start to get into the stage of what is it that we need to do in terms of quality improvements, workforce improvements, and then what can we do? So as I said before, these are the questions we have to answer, and we'll start taking testimony from people once we have a bill in here and sort out what we can do. I don't know if, Nolan, is there anything else that we should be asking that we're not?
Where do I start? I think over the last couple of days, I've heard a lot of great questions from all the committees. Unfortunately, everybody can't hear everybody else's questions, but everybody's focused a little differently. The other thing I'll add is that we do have them on contract until early April to help answer questions about the report, not to run new analyses.
No.
But to help us understand stuff that's within the scope of the work and the contract. If you have more questions, we can get them questions and they can answer them. We just can't have new work on it.
I did have one more question. I know we're just gonna it's actually 10 o'clock right now, but if I could ask one more question and maybe there's an answer that we can get through Nolan or whatever, it may be a simple answer. So if we extracted all the 4-year-olds out of this equation and said that they're gonna go into pre-K, I'll just assume that it's 60% of the 4-year-olds are gonna leave. And then is there a way that we can make a determination of what effect that would have on the cost of the care and what the other needs are?
That's not a simple.
It's not in the report. No, it's not in the report. And it's not something that's predictable from the information that's in the report. Okay, I just wanted to clarify that. Because it's a different question from saying what would it cost if all the 4-year-olds went to school, went to pre-K. But what will the effect be at the other side of this in here? So, okay. All right, thank you. This is super. And again, this is you're here, and we so much appreciate all the time that each of you has given us. I can't overstate that. It's been really terrific. And I know that I'll probably be seeing you. Will I see him again today or not?
No.
Yes. No.
No, unless you're an in-house member.
No, that's too
Well,
bad.
you can always zoom in and watch.
I know, we will, but that's the other thing,
Mhm.
all of this is recorded, so our committee can look at other committee questions and answers, and I think the more we engage, the better it will be for us, because there's a lot of information.
And I thought that the joint finance and appropriations meeting yesterday had a lot of really good questions, and many that hadn't been asked in here, so you could watch that on 1.5 times speed on your, like, with all your free time.
Yeah, so it'll be weekend.
Surprised how quick an hour goes at 1.5 times speed.
But again, Chris and Aaron and Lynn, thank you each for coming in. We greatly appreciate it. Thank you for your work. It's just very helpful. We'll go offline.